A production fee for your Hometown Health Connection was made by Buffalo Healthy Living Magazine and its sponsors. Do you or someone you love live with physical pain? Chronic pain is certainly a common issue. In 2018, the Centers for Disease Control and Prevention released a report that an estimated 50 million Americans, or just over 20% of us, have some form of chronic pain. Is there help beyond pain medication? We'll find out about some alternative therapies that can help you live pain-free on this edition of your Hometown Health Connection. I'm John DeSciullo. Samantha Latshaw is on assignment. So many of you watching may be suffering from pain and not know where to turn. Stay with us for this important half hour when I introduce you to Dr. Christian Milioto, DC, from Western New York Pain Relief and Integrative Wellness. This young Western New Yorker is compassionate and empathetic, determined to help deliver the total package in making you pain-free. Not only because he cares for his patients, but because he suffered from chronic pain himself. He received his Doctor of Chiropractic degree from Duville College, where he worked at the campus clinic, spent time shadowing radiologists at Western New York MRI, studied at the ECMC Hospital Trauma Center, helped patients at UB Neuro and Dent Neurologic, especially with patients who had been through major trauma. For his doctorate, he had externships and specialized in patient care on all levels, including nutrition, therapeutic laser, spinal decompression, and more therapies that we will discuss. Now, to provide the best plan for his patient's needs for the total mind and body experience, he will do that because he knows how difficult it is for a person to function when they are in pain. Welcome, Christian Milioto, Dr. Milioto.
Thank you so much for having me.
Oh, I'm happy to meet you. You have such an empathetic way about you, so you're so compassionate in just talking with you a little bit. We said you almost have an old soul a little bit.
Yeah.
What you've got for
you. A lot of people say that.
And I guess we should start really briefly about your journey with pain, because it's from that personal experience that you've been able to really understand probably more acutely what your patients are going through. Tell us about your journey.
Absolutely. So sitting before you, you wouldn't know it unless I told you, but I have disc herniations in my neck. I have disc herniations in my back. I had issues with my ankle, and I dealt with chronic pain for a majority of my college career. Now I'm going to be 33 in a couple weeks, and since I was about 21, I had chronic pain. And I noticed the pain got worse and worse and worse. And what I started to notice was I lost function, I lost quality of life. I couldn't do the things I wanted to do, nor did I want to get out of the house. And it wasn't until I was able to actually eliminate these conditions and treat them that I really started to understand what it means to treat acute and chronic pain. If you don't eliminate inflammation, it will consume you, and it slows down how your body heals very quickly.
Where was the pain?
So I had a disc herniation in my back at L5-S1. I have a cervical herniation at L3, L4, and then I also had an issue with an ankle injury from basketball, so I had kind of a trifecta. With the nerve root in my foot, it's associated with the same nerve root in my back. So it was almost like I call it a kinetic chain disorder. If you have the inflammation in the nerve root from top, and on the bottom they call it a double crush injury. And it would get to the point where it would debilitate me. I couldn't walk, I couldn't run. I had to pull over sometimes because the pain was so bad in the car and I was nauseous. I also had to excuse myself from consultations with my own patients because I couldn't think about the pain anymore. It was like somebody stabbing me in the back.
Now, it seems that was awfully young for you to have this pain.
Yeah.
Was it all of these things just combined to give you that pain? Was there something that triggered it?
Well, to be honest with you, chronic pain starts with an injury, okay? And as everybody that's watching this might know, you have some back pain, some neck pain, maybe some burning, numbness, or tingling. You get these symptoms, but they go away. And then eventually they come back, go away, come back, get worse, get worse. Then you hit that point where your body's no longer healing. You have chronic inflammation.
Right.
And that's how it was for me. Then the biggest thing is we're all not doctors, right? You know, when this pain happened to me, I wasn't a doctor. I was an undergraduate student studying biology, getting my first degree, had no idea what was going on with my body, didn't seek the care, and you know, I'm kind of a hard-headed Italian. I used to say to myself, you'll get better, it's no big deal, it'll heal.
You're also younger, so you're thinking you can fight it off because you're younger.
Right, and then what happens is one day that doesn't happen.
Right.
And then I hit the point where it was chronic, and I had to do something about it.
So with that, you were probably prescribed medication, and I know that you have some strong beliefs about medication. Some pain medication does work for so many people. We're not here to tell people to come off their pain medication, but at the same time, that medication for you didn't really work well.
There are medications you need to take: blood pressure, cholesterol, diabetic, things that actually help the body, or conditions where you could get sick. You don't want to have a stroke, and you definitely don't want to have a diabetic episode, right? But pain medication is technically not something you have to be on for the rest of your life.
It can be very addicting too.
It can, depending on what you're taking. You know, you take me, for example, I took Tylenol, didn't do anything. I took Aleve, temporary relief. Then it got to the point where I was taking not 2, but 4 Aleve a day, or 5 Aleve. That's too much. Kills your kidneys, kills your liver. Then the doctor tried Celebrex. You know, there's a lot of different things. A lot of the population that I work with, they might take things like gabapentin, Lyrica, Cymbalta, Lortabs, hydrocodone, you know, and those things don't actually work on pain. They work on calming down the brain's interpretation of pain. And for most people, outside of, you know, the narcotics like hydrocodone, the gabapentin and the Lyrica for nerve and joint disorders in the body, they actually don't do anything. Those drugs were not designed for pain. They're anti-seizure or anti-anxiety medications.
So there you are, you're taking this pain medication, and now fast forward, you're helping people with therapies that by and large do not include pain medication.
Our sole goal is to eliminate the use of drugs, or eliminate the use of a surgery, or a second or third or multiple. That's what we do.
What is the root cause of pain? I mean, it's kind of a broad question, and we don't have a lot of time, but you know, you hear a lot about back pain and your carpal tunnel. There's all these pains.
So in general, pain in the body is the result of a few different things. I call it getting to the root cause of your inflammation. Now, everybody's customized, okay? Not everybody has the same type of pain, but you can have the same types of elements of pain. So people with neck or back pain, is it a disc herniation or a bulge, or is it spinal stenosis? Do you have neuropathy in your hands or feet? But the end result is the inflammation is the same thing in the body. It's changed to the joint, the nerve, the muscle, and the blood supply. And then acute and chronic pain breathes off of that. So the worse it gets, the worse the pain gets.
So with everything that you've accomplished in your very short years, and I can tell you, being almost 60, you're a young guy, which is great. Now you're working with patients, and you have, I think, what I would best describe as a total patient approach. So when somebody goes in for a consultation and you just define certain types of pain, I would suspect that that's part of your consultation. You find out what the pain is, but you want to give that patient a total package.
Absolutely. When a person comes into my office, I always jokingly tell them, I don't care about your diagnosis. I care about you. Tell me what you feel. Tell me what your pain is. How did it affect you, and where are you now? A lot of doctors, I say, get something called satisfaction of search. You come in, you tell the doctor, my back hurts, my feet hurt. Okay, well, maybe you have peripheral neuropathy. Maybe you have a disc bulge or a herniation. But that inflammation affects more than just the back. People get nerve symptoms. They lose function, balance, strength, weakness. And when I focus on you, I focus on the person. And my sole goal is not to only eliminate the condition that you're dealing with, but to actually provide your body with the healing elements, so that as much as I love you, I see you as little as possible, because I know we did our job. And that's why I actually comprised an office that's completely suited on researched and evidence-based treatments, along with the best types of FDA-approved therapies that you can use outside of drugs and surgery.
So let's talk about some of those therapies. We'll start with spinal decompression, and I know you have a machine there called the DRX 9000.
Yes, sir.
So talk to us, and we have a lot of treatments to go through, Christian, so we'll try to keep them real brief. Spinal decompression, DRX 9000, what is it?
It is the gold standard for people with neck or low back pain. It doesn't matter if you're 15 years old or 100 years old. I have put everybody on that machine. Gold standard means the best therapy you can use outside of drugs and surgery, okay? Now, surgery is not always the answer, and you should always have somebody in to address that. But this is the first step in my treatment. So this is where I might utilize this machine. It's going to work on people with back pain, muscle issues, stenosis, sciatica, any type of disc bulge or herniation, even basic arthritis. It is the #1 treatment to use if you are experiencing symptoms in your back, neck, hands, legs, or feet.
And the number of treatments with spinal decompression or any of your therapies would be determined based on the reduction of pain that could come in a short period or a long period.
Correct. Everything is customized to you. And with our treatment protocol, truthfully, we do eliminate 85 to 95% of your condition in 4 to 8 weeks.
Let's talk about bulging disc therapy.
Yeah, so bulging disc is one example of how we'll utilize the decompression. There are a couple other therapies that I utilize, which we'll talk about, but the disc bulge in the back is basically something that a lot of us have. As we get older, our discs shrink. So if you've ever noticed you feel shorter, or that you've lost your height, or you feel like you're starting to get some symptoms in the back legs or feet, you most likely have small or large disc bulges or herniations, some arthritic inflammation, and then the nerve roots in the spinal cord in that area have become inflamed to the point where you're starting to lose some function. A lot of people, especially the older population, will say, I have stiff backs, you know, early morning, late at night, while I'm gardening, doing lawn work, especially now with summer.
Sure. Electromagnesia, is that what it's called?
Electro Analgesic therapy.
Okay.
So that's actually just a broad term for the machine we actually utilize. A lot of people have heard of things like TENS units or stim units. The machine that we have actually works on the individual at their time. Now this is the second part of our treatment. So this is where we work on your nerve and your inflammatory process. For people, they love this part because this is where they have physical pain or the elimination of that pain. So this machine will work on the damaged nerve and muscle and then eliminate any numbness, burning, tingling, sharp pain, or muscle spasms.
Laser therapy. We've heard about lasers and the miracles that sometimes they can create.
Yeah, so lasers started about 7,500 years ago. Medical profession didn't believe in them. First people to use them, jokingly, was actually a veterinarian. Dogs can't lie. You use a laser on a dog that has severe arthritis and hip problems, and they come and can't walking and they leave. Well, the medical profession got really turned on by this, and they said, hey, we can use this to help people. Now there's 5 classes of lasers. Most people, if you've heard of them or used them, it's 1, 2, or 3 class. We have a class 4. It's a step down from a surgical laser. The laser actually penetrates down to the bone, it increases circulation, eliminates inflammation, and actually rapidly increases the healing process by up to 85%.
We have about 3 minutes left in the segment. I want to get through these. Neuropathy therapy.
Yeah, so we have honestly the most advanced neuropathy treatment in the city. We work on people who have had diabetes, chemo or radiation therapy, idiopathic neuropathy, which is there's no known diagnosis, which we actually do come to a conclusion with all of our patients that there is a known cause for that. And our neuropathy protocol actually works on the symptoms they're feeling. So that's generally numbness, burning, or tingling, pins and needles. Sometimes people will say creepy crawlies. And then we use a couple other therapies in conjunction because with neuropathy, what happens is the nerve is damaged, but it's lacking nutrients, and there's damage to something called the myelin sheath. So we have to heal the nerve, we have to heal the blood supply, and that's how you eliminate the diabetic neuropathy symptoms or the regular neuropathy they feel.
There's some secondary treatments, and I'll tick through them, and then you can kind of bunch them up.
Yeah.
WB therapy stands for?
Whole body vibration.
Dry hydrotherapy, and then the infrared sauna. How does all of that work?
So infrared light therapy is extremely beneficial for people with inflammation throughout the entire body, fibromyalgia, muscle or joint pain, severe bone-on-bone arthritis. The hydromassage, our Ergotech massage chair, and the whole body vibration are used after the primary treatments. The hydromassage and the Ergotech are used to increase circulation. They help to drive inflammation out of the body. So the patient gets a massage and they love that. But really what it's accomplishing for us is the elimination of the bad stuff we release with each treatment. The whole body vibration is a technology used as our form of physical therapy. So most people who have experienced physical therapy and you have pain, you know it's very difficult to do, and it's even harder to do the exercises at home. Well, the whole body vibration will allow somebody to actually accomplish the same therapeutic benefits in 10 minutes, and it's the equivalent of a 30 to 40 minute exercise at the gym or PT routine. How
do you respond to people? This is the last question in our segment here, Christian, before we go to break. How do you respond to people or other medical experts who say some of these therapies don't work?
So a lot of times people who come to me and they say, well, my medical doctor says it doesn't work or they don't know. The truth of the matter is they haven't done the research. Everything in our office is comprised of research and evidence-based treatments. That means if you come into my office or you come to one of my seminars, you can ask me for a document that's actually published by the major research groups in our country that not only prove how the therapy is going to help you, but actually provides the healing process. And then what I've honestly done is I've taken those technologies and I've customized them to each person's needs. And each one of our therapies will work on anything head to toe.
Well, we're going to meet some of the people that Dr. Milioto has helped because we're going to be back to continue our conversation with Christian Milioto and hear about those patient success stories and some information where you can connect right after this short break. Write this information down on how you can connect with Dr. Milioto at Western New York Pain Relief and Integrative Wellness. They're located at 4415 Union Road in Cheektowaga. Write down this number and keep it handy. Give them a call at 716-650-PAIN. That's 650-7246. And online you can find out more at buffalopainrelief.com. Buffalo Healthy Living Magazine is a free, full-color magazine distributed throughout Western New York. Now, more than ever, as we all want our families and friends to be safe and well, Buffalo Healthy Living Magazine is devoted to health, fitness, and nutrition for people of all ages. It's a great read and also has great recipes. Pick up Buffalo Healthy Living Magazine all over our hometown or go online anytime at buffalohealthyliving.com.
The pain just got worse and worse and worse. It started with back problems, and then I started losing movement in my legs, and I went from walking freely to going to a cane and then going to a walker, and I'm sitting here in a wheelchair now, and but things are getting better. I've been coming here for about 4 weeks now. I'm scheduled for 8 weeks, and I mean, things are progressing very well. I mean, I've noticed I've been able to do more and more things. Like my wife used to take me to the vehicle in my wheelchair, and I used to have to grab the steering wheel with my cane to pull myself up. And now I can stand up freely and hop in the car. So I just want to get back to my old self again, and I'll do anything it takes. I mean, I'm doing the exercises at home. I'm here weekly, or twice a week, and I just want everything to go well. I recommend this place to anybody. I mean, like I says, my last place I went to was shot after shot after shot, and this is a nice drug-free environment where they work you on the machines and then let the machines do the work.
You're watching your Hometown Health Connection, and our guest is Dr. Christian Milioto from Western New York Pain Relief and Integrative Wellness. And we just heard from a patient of yours, Dr. Milioto, with an incredible success story.
Yeah.
And that must mean so much to you to know that you've helped this individual so significantly.
Words can honestly not express how proud of him I am. Honestly, the treatments I do, that's one thing, but the credit goes to him. I mean, when he came in, he couldn't walk, he couldn't get out of a wheelchair. His first treatment with me, he collapsed getting onto the decompression table. And to the point of his last visit last week, Thursday, 5 treatments in, he stands up out of the chair, stands up for 2 minutes while I put his treatment harness on, and then steps up onto the table himself. Words can't express how proud of him I am that he's made this accomplishment to this point.
Well, that said, I would suspect that some people may look to you and your center as the last stop on their journey of pain, when in reality, it maybe should be their first stop.
Yeah, I mean, a lot of people will come to me and they've already done it all and seen it all. Medications, drugs, surgery, multiple doctors, rounds of PT, acupuncture, you name it. And a lot of people do come to me and say that. And the first thing I say is stop, okay? I know that you just came to me now, you're just meeting me, you're seeing these things that can help you. But the truth of the matter is we met each other one way or another, okay? So the best thing you're gonna get out of me is 100% of my dedication and care. You're gonna be educated on how we're gonna help you, and we're gonna get you to that level. And I always tell people I'm never gonna overpromise and underdeliver. I'm gonna be honest with you and upfront, because you're already at a point where you don't feel there's any hope. And the only thing I wanna give people is that hope, and then accomplish that goal. And then when they walk out that door that day and they say, look, I am doing the things I wanna do, it's the best gift you can ask for.
And I know you offer seminars too,
yeah,
that are educational in nature. And I know COVID has changed some of the dynamic of that, and hopefully things will go back to a more normal way. What is that all about?
Yeah, so my seminar is completely educational. It's to educate people about the conditions they're feeling, from back pain, neck pain, bulges, herniations, down to neuropathy. The sole purpose is to teach people about their bodies, what they're experiencing, some of the medications they've been on, or some of the treatments they've had, why they haven't had success. Generally, it's because inflammation and pain is more than just one thing. You have to work on all the elements of that person. And then at the end, we address some of the things we can do. But it's not meant to be a sale for people. It's meant to empower patients. I always teach people about how to go about their care. Even if after that seminar or after their consultation, they don't become my patient. That's okay. The purpose is to help you learn about the right steps to take if you want to eliminate the use of drugs or avoid surgeries.
And in addition to avoiding drugs and surgeries, I would suspect you probably educate people on how to avoid getting into a situation that's painful.
Yeah.
You know, we talked about the differences in age, and, you know, look, let's face it, there are guys my age who shouldn't be doing the things they're doing at my age, but they think, you know, they think that they're 32, like,
Yeah.
you know, like you are. So how do you educate somebody to avoid a situation of getting into pain and doing the things that, you know, might be up here?
So to be honest with you, you know, I always tell people pain is physical, mental, and emotional, okay? But a lot of my patients, they are a little bit older. They'll say, hey, should I not do X, Y, or Z? You know, gardening, mowing the lawn, whatever. And I say, no, you should. But know that everything in moderation. You know, I had a patient who was doing so well with me with spinal stenosis. Her one goal was to walk her 10 blocks down her street, okay? So that weekend she tells me she's gonna do it, and I say, look, just remember where you go, you gotta get back to, okay? So she walked it. She walked the full 10 blocks and came majority of the way back. And then she actually called me that day and she says, well, I didn't listen to you. And I said, what happened? She said, oh, I just felt tired. I had to call my husband to pick me up. But you know what, Christian? I did it. And you know, that's the important thing. So yes, everything in moderation, but it's all about communication. If you have a question, you can call me. I have people who called me at 1 o'clock in the morning. I am there to help you on any level.
You talked about age. When you were young, you had some issues.
Yeah.
Most people associate pain with people who are older.
Yeah.
And you have a story about a significantly older patient who I would suspect maybe had given up, but you gave that individual some new hope.
Yeah, I've had a couple people. I mean, I've had people who have come in with neuropathy in their feet. It was a waitress at Carrabba's. You know, she had excruciating nerve pain, was crying one day when I opened the doors. Just after doing the laser treatment, the increase in circulation helps that inflammation go. I had another patient, a very, very old woman. She was in her late 90s, severe spinal stenosis on a respirator, a walker with numbness in her feet. The only thing she wanted to do was be a fly south bird to go to Georgia for the winter. Doctor told her if she got on a plane, she would not survive it. That's how bad it was. In 8 weeks, we actually improved the symptoms in her legs and feet, improved her balance and strength. She went to Atlanta, Georgia, and called me when she got there.
Good job for her.
Yeah.
That's terrific. Let's talk a little bit about how you handle the cost of your therapies.
Yeah.
You know, insurance covers some of it, but sometimes it doesn't. And how do you work with the patient that's going to come in and say, I need your help, but I also need help in paying for this?
Everything starts with a consultation. So I don't charge for my consultations. I don't care if you're in my office for 3 hours with your health and you walk out my door with a handshake. It doesn't matter. I don't know what the cost is going to be. I don't know what insurance is going to cover. We work with all insurance companies, and your treatments will be based on that. For those of you who can't afford to pay out of pocket or utilize therapies in our office without paying out of pocket with no insurance coverage, we do have ways to afford it. We have medical programs we work with. They work solely with offices like myself that do specialized care, and the treatment plans could be as little as $40 to $50 a month.
And we should mention we do some other programs with some other medical experts who are dentists particularly, and they kind of follow the same format.
Yep.
So those opportunities are out there because you're really making an investment in yourself to better your life and then in turn the life of your family as well.
Right.
And we should mention that everyone is welcome to your facility. It's at 4415 Union Road, and you know, you're still being cautious, I know, but you're still seeing your patients there. And it's a good experience for people of any age. Tell us about the team that you have in place.
Yeah, so there's a team of 3 doctors. That's the only team you're ever going to work with. We don't have any assistants or any other staff, okay? There's a reason why I call myself integrative. Not only do we want to provide everything under one roof to help with your inflammation and the healing process, but we're also bringing in a nurse practitioner who will specialize in neurologic disorders, medical marijuana and things like that, scripts for PTs. I do have an in-house physical therapist, and we also offer a nutritional program that not only provides inflammatory healing, but weight loss. I'm actually an example of that. I just finished up the program last week. I started the program at 232 pounds. Today I weighed in at 190.2.
No kidding. I would suspect that weight must have some significant impact on pain if somebody's carrying extra weight around.
It definitely can, especially if you're deconditioned. A lot of people ask me that. A lot of doctors will tell people you're overweight or you need to lose weight. But really what I say to that is, look, it's not about the weight, it's about the inflammation. Fat holds inflammation. Pain holds inflammation. If you have all of that, you can't heal. So a lot of people with back pain or symptoms, they might do the weight loss program with me as well. It's very simple. It's 6 weeks long. And hey, if in 6 weeks with no working out and trusting me and working with me day in and day out, we're conversing, and you see the progress, it just falls off of people. And it is extremely beneficial.
We do have a culture of enjoying food in Western New York.
Yes, we do.
Maybe isn't the best for the waistline or other things, but so I would imagine you have to sort of change the psyche a little bit.
Oh, yeah.
Get people to start eating foods that they may not have made the first selection to take.
I mean, I will be the first person to tell you you're looking at an Italian who was overfed by his grandma in bed 24/7. It actually got to a point where my parents one day had to say, Graham, you got to stop taking a Christian to McDonald's every day. And she says, oh, well, he wanted, you know, and that's just how they were. Well, at some point, you know, I was 302 pounds, at my biggest in college. It was before I became a doctor, and I realized you can't promote health and wellness and not know what you're doing. So I taught myself nutrition. I taught myself working with the body and biomechanics. And that not only helped me with healing and losing weight, but it actually helped me in understanding pain and inflammation. Because that's the last thing we do is we rehab the patient. So not only do we eliminate your condition, but we do a couple simple things that take you to the next level so that you now know how to take care of yourself. It's called going from passive care, which is coming to me, to active care, which is the patient now can take care of themselves.
And you have an active family. Tell us about your family.
Yeah, so I have my wife, Jessica. I have 2 beautiful kids, Lorenzo and Emery. My son's going to be 3 in July, and my daughter, Emery, is now 1 year and 2 months. I actually have one on the way, and it's a girl. She's going to be coming in November. And I have an amazing family. I have 2 parents. They're still alive. My grandma's still alive. My grandma's one of the big reasons why I went into what I do today. I watched her wither away on pain medications and multiple surgeries, and I wasn't educated at the time. I didn't know how to help people. And now that I know, I understand what she went through. I understand the massive amount of steroids and the thing that debilitated her. You know, we're sitting at Sunday dinner and she coughs and breaks 4 ribs. That's something I want to help prevent. So every person that steps into my office, I understand what it means to have that gift to try and help somebody. And truthfully, you know, having awesome parents like my family are a big reason why I am the way I am. I'm very empathetic, and I put my heart into everything I do.
And you're dedicated to Western New York, and we appreciate that.
Thank you so much.
We're going to have information on where you can connect with Dr. Milioto and his team. Thank you for joining us here on this edition
Thank you,
of your
sir.
Hometown
I
Health
appreciate it.
Edition.
It was an honor.
Thank you very much. Remember, if you or a loved one are in pain, there is help. Here's the information on how you can connect with Dr. Milioto at Western New York Pain Relief and Integrative Wellness. They're located at 4415 Union Road in Cheektowaga. Again, write down this number. If you didn't get it earlier, keep it handy. Give him a call at 716-650-PAIN. That's 650-7246. And online, you can find out more at buffalopainrelief.com. I'm John DeSciullo in for Samantha Latshaw. Thanks for watching. Be safe and be well. A production fee for the preceding presentation of Your Hometown Health Connection was made by Buffalo Healthy Living Magazine and its sponsors.